Yeah, I think that the the healthcare institutions, hospitals, skilled nursing facilities, they're all looking for talent, and they want talent when they need it, because they can't actually control when you and I get sick. When we get sick, we go to a hospital, and they have very minimal amount of staff that they carry because staff is fairly expensive. So when census go up, when you and I are sick and we go to the hospital, and ER room is busy, well, they need temporary help because they want to go out there, survive through that temporary time because they don't want to have an 3 hour, 4 hour ER wait. They want to go out there, be able to take care of our family and friends when we go to ER timely. So really what's taking place is they're looking for an efficient way to solve that problem. And in order to go solve that problem, really different tools and technologies have to be in play to be able to make that happen. Because they hospital need the people when they want it. When they don't want it, they want them to disappear because it's a tremendous amount of expense. So what's really changing is like in manufacturing, most of the automakers and other companies now went to just in time kind of concept, right? So when they need the parts arrive, or the parts arrive like a week earlier, so they don't carry a lot of inventory. I think long term, hospitals are going to get to the same stage. So when they're scheduling surgeries next week, they know what staff they're going to need for the surgeries. So they call the staff, they perform the surgeries. When they don't need the surgeries, staff disappears. But think about it, you and I, right? The Uber company taught us a lot of interesting things. One of the simplest things they taught us, we want to work when we want to work. So we turn ourselves on. We say, you know what? I'm looking for this kind of job, this schedule, this shift, and this pay. When the right job matches, it tells me, and I said, no, 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 I want that one. I go work. And when I'm done, I'm done. So I'm very pleased too. So I think it works for all parties. The just in time concept would work on all parties. The question is, in the past, they'd never been able to make it happen is because the technology was inefficient. It wasn't working very well. And I think as the technology is getting there, is making it so much easier to be able to go do it. So that's one change, which is right, taking the industry in such a way, hospital get the help that they want it. When they don't want it, the people disappear. So that's really probably the biggest, I would say, the change that's coming. And I think in few years, you're going to see more and more of that.